The media has been really, I would say fear-mongering in a way lately with the new cases. The cases are up, the graphs are looking like this. Is that as bad as they're making it seem? What are the numbers we really should be tracking, and kind of what's really going on from a doctor's perspective when it comes to how bad the second surge has been?
I want to always say, because I don't want to say that this isn't a real problem. It is a real problem for patients who've got comorbid conditions. I treat this all the time. It's a real disease in those populations. However, this incessant focus on cases being reported by the media, they're just using words to fool people. A few months ago, we would have called that herd immunity. What cases are, you need to translate in your mind, it's not a case. It's a positive test result. Tons of people are getting tested. Tons of people are positive. The vast majority, or at least the majority, are asymptomatic or mild. And a very few get sick, and a very, very small percentage of those people get very sick. Most of the people we see with positive case results have no symptoms. Some that have symptoms overwhelmingly don't need hospitalization. So in your mind, take that word cases and throw it away and replace it with positive test result. That's what the media means when they're saying cases. The other thing that's very disturbing, I've heard from people all over the country, patients and doctors, that the amount of fraud going on is rampant. I didn't believe it the first, 10 times. I was very skeptical. I've heard this at least 20 or 30 times now about situations where patients are getting positive results, which is impossible. We know it's impossible because the patient signed up for the test but never actually got the test. So they'd sign up like at CVS, they go, but there's a long line. So they say, you know what, I'm not going to wait. I'm not going to do it. They go home, and then in a week they're notified they have a positive test result. I've had dozens of claims like that, dozens.
I've also heard people who got tested multiple times and tested positive, then tested positive again, maybe a few days later, and that counts as 2 cases into the same batch with everyone else.
Oh my gosh, I'm so glad you asked that. So patients are being tested multiple times. By the way, the amount of testing that's going on is huge, right? Because patients are just showing up and wanting it. But for example, everyone who comes into the hospital is tested. Patients in the hospital get tested multiple times. If you get tested multiple times, that counts. Every time you take the test, that's another positive result. So I personally had situations, a person's had 4 positive tests. And in Texas, I know because I have a colleague in Texas, and the way they report the positive results in Texas is so bizarre. There's a blood test, and it's the IgM or the IgG. One of them really means longer term immunity. It's not really a positive result. It actually means you've recovered. They're counting that as positive. They're also counting if one person in a family or a group of 15 is positive, and anybody else in that group had any kind of symptoms, that person's considered positive without a test. I mean, it is just crazy how they're using the numbers.
When it comes to the cases, you beautifully explained that. What are the numbers we should be monitoring? Is it hospitalizations? Is it the death rate? Is it capacity? And what are those kind of stats when it comes to how we're handling it as a country?
So the only number that's more or less reliable is the mortality rate. I say more or less because there is evidence that people are being called COVID deaths that were not COVID deaths. But what can't be tampered with is if somebody died or not. So it's worth paying attention to the mortality rate. Everything else, I think, is not worth paying much attention to. So the mortality rate is very, very, very low. There's tons of graphs, it went up, now it's down. We're almost at the bottom. That number makes sense. The number of quote-unquote of cases doesn't matter because of all the reasons we said. The other thing to keep in mind is, remember how we talked a lot about flattening the curve? The whole point of this was not to overwhelm our healthcare system, and that is what you must focus on. We are not overwhelming our healthcare system. There are still lots of hospital beds, hospital capacity. I'm an emergency physician, so there are a lot of patients, and it certainly has picked up in the last month. It's true. But the number of patients I'm admitting into the hospital has not risen past the capacity of hospitals to manage it at all. Right? So sometimes the hospital comes close to capacity. That's normal. Hospitals want to operate close to capacity. Their profit margins at a baseline are only about 2% as an industry. They need to operate close to capacity or they'll go under. So when you hear 95 capacity, that's normal. What hospitals do if they're maxed out is they transfer to another hospital. That's just what we do. So we're not in any jeopardy at all as a system. It could happen that one particular hospital in your neighborhood could get full that day or that week, right? And they might have to transfer you to another place. It could happen. That happens all the time in medicine. That is not a unique occurrence at all. So to review, there are lots of cases. Overwhelmingly, they go home. They don't need hospitalization. The ones that need hospitalization, we absolutely have capacity to absorb those.
With the availability of hydroxychloroquine, I feel like that would kind of change the policies that have been put into place to fight against COVID, especially with lockdowns and stuff, keeping kids out of schools. What do you think would happen if hydroxychloroquine became readily available? And how would you compare that kind of to where things are headed now with the lockdowns and keeping the schools closed and stuff?
So I like to remind people that I'm a doctor and a lawyer, and that's why I jumped into this. But the reason it's relevant is I kept thinking, what's the best way forward for us as a society, as a physician, as a lawyer, as an American? The issue of lockdown and masks in schools, it all goes away if the fear goes away. The fear goes away as soon as people realize this is not a deadly disease in the first place. It doesn't really hurt younger, healthier people overwhelmingly. There's always exceptions. But the people that are living in fear, let's get rid of the fear. If we get rid of the fear, Fleckus, we get rid of the lockdowns, we get rid of the masks, we get rid of the nervousness about schools. By the way, I didn't even talk with you about schools. You know, the data on schools is overwhelming. We should do a whole video on that. But there's really no risk of transmission from kids to adults. The numbers are zero. There is no science at all whatsoever to support closing schools. None. The first thing is you need to think of things not as safe or unsafe. Life is inherently risky. It's a little more risky. It's a little less risky. Not going to school is a high-risk activity. Children in LAUSD, for example, apparently 30% of them never even signed on online one time. All right? Never mind the kids who are not being picked up for child abuse or not getting hot lunches, not socializing, of course not learning. There's a huge risk to children not going to school, just absolutely enormous. Let's compare that to the risk of going to school. Let's look at the science, all right? We have a lot of data on this now. People may know that Sweden didn't close down, including they didn't shut down their schools. It so happens that one of their neighboring countries, Finland, did more like America. So what's neat about that is we can completely compare Sweden's response and Finland's response, and we can see how it is with the schools. If you can just take a moment, I just want to look at the data, okay? In a study published by the Finnish Institute for Health and Welfare, they found the following. There is no difference in the overall incidence of the laboratory-confirmed COVID cases in the age group 1 to 19 in the two countries. In conclusion, closure or not of schools had no measurable direct impact on the number of laboratory-confirmed cases in school-aged children in Finland or Sweden. The negative effects of closing schools must be weighed against the positive indirect effects it have on mitigating the pandemic. In other words, if you close the schools or you don't close the schools, the rate of COVID is the same. And we know that closing the schools is a high-risk activity for children.
They aren't susceptible really to catching COVID as much as older people or people with pre-existing conditions. So closing schools in the fall does not make sense to you.
You know, that was one of the craziest myths, I thought, when I first heard it, that there's like asymptomatic super spreaders out there. I mean, man, what a way to like scare people. Do you know what? I'm going to go aggressively and say, not only doesn't it make sense, it's harmful and it's negligent on the part of adults to say this. If you look closely, this is really a political movement or union movement. This is not at all about the children. There is no doubt that closing the schools is bad for the children and is not healthy for the children. Children don't get sick, seriously sick from this disease. They have essentially immunity. Everybody's been afraid to call it immunity, but what do you call it if this thing is out there and they don't get it? Because I call that immunity. They simply don't get it. It's a complete different situation with children. As I've said before, you go to data.cdc.gov and you can look at the COVID cases by ages, and you can see that children don't get this disease, and they certainly don't die from this disease. Again, there's always rare exceptions, but you would never close a school for numbers that were much less than influenza numbers. We don't talk about closing the school for influenza, and this is much, much, much less risky than influenza.
From these studies, we can kind of see that children, I guess, aren't spreading the disease as people have said they are. Is that accurate to say?
So we finally have some data on, is there really super spreaders? And here it is. There's a study done in Ireland, and they looked at 3 pediatric cases and 3 adult cases of COVID-19 with a history of school attendance. And this is what they found. A total of those 3 kids and 3 adults, They contact traced 1,155 of those contacts. They were exposed at school, they were exposed in the classroom, during sports lessons, music lessons, choir practice, and they found that among 1,001 child contacts of these 6 cases, there were no confirmed cases of COVID-19. None. 0. That's the theory of super spreaders. It doesn't exist.